Welcome to Showcase Richmond. I'm Chip Tarkenton. Having an illness, injury, or condition that makes it hard to get around or function is, of course, draining emotionally and physically. Being at home is so important, yet you don't want your loved one to get hurt or suffer without the proper medical care. So often we're troubled on what to do. Care Advantage is a way to keep your loved ones comfortable and able to receive quality and compassionate care while being at home. To tell us more are Barbara Retone, she's the Vice President of Clinical Operations, and Joe Petty, Management Consultant. Great to have both of you in here. Joe, give us an overview of Care Advantage and all about care.
Chip, Care Advantage was started 22 years ago by our founder, Deborah Johnston, who is a registered nurse, and started the company with the idea of providing compassionate care to the elderly in-home. All About Care was started as a subsidiary of Care Advantage 6 years ago to provide the professional, skilled nursing services and therapy services that will allow patients to recover in the safe surrounding of their home.
Barbara, what are services that are provided and how does a patient get them?
We provide professional nursing services and therapy services, which includes physical, occupational, speech therapy, and we also provide home health aid services to our patients. It's very easy to get the services. Sometimes patients call us directly and then we will contact their physicians. Many times when patients are in the hospital or in a rehab facility, as they're discharged, then they're referred to us to take care of them.
Joe, who qualifies for these services?
Well, that's the thing. Many patients may not know that they qualify for their services. Most of our patients are referred through a physician referral. However, we take care of elderly and disabled and folks recovering from surgeries. So there are folks that do qualify. Most of the qualification comes from whether that patient is in home and is recovering from a surgical procedure or a medical condition that requires a skilled nurse or a therapist to visit.
Barbara, what about continuity of care and the Bridge to Home program? Can you help us with those?
Sure. The Bridge to Home program is a way for us to help the patient become stable after a discharge from an inpatient facility. We found that when patients are discharged and as they're getting themselves back into their normal routine and recovering at home, they're in a period of transition where they might need additional services. So one of the programs that we have implemented is the Lifeline program, where our patients wear the personal emergency response system. We're able to provide that to them at no cost while they're on service with us. And if they would suffer a fall or have some sort of an emergency, then we're able to be in touch with them immediately. Another thing that we're offering is, besides our skilled services, our home health aides to go in to help them with their meals, with any kind of housekeeping, just some additional support during those first couple of weeks of return to home.
My guess is that is an important service to have, and it's just probably unbelievable the help that somebody can get from just you folks being there.
It is, and choosing a home health agency is stressful enough, and our mission is to make it as easy of a transition as possible and take the stress out of making the selection.
Yeah, and it is tough for families to make that decision. Very, very difficult. I want to thank you first for what you folks have done with Showcase Richmond, and thanks so much for being a part of that. We're going to put the information up on the screen because y'all have brought some great segments on the air to us. Care Advantage, located on Midlothian Turnpike, 560-5430. You see the web address as well, and the email. You can get to them very easily, and they just do a sensational job of what they do. And thanks to both of you for coming in and being a part of Showcase Richmond today and give us some great information about who you are and what you do.
Thank you.